go ahead and start the live stream. Good morning, everyone. It is Friday, March 15th. Welcome to the Public Health and Minority Health Disparities Subcommittee. Today we are joined by our chair and our vice chair. So this is going to be one for the books. We're going to start today. We've got six bills on the agenda, some outstanding bills that we're going to make sure are outstanding bills. And we're going to start with House Bill 353 and House Bill 822, who are our vice chair's bills. She's been doing good work on them, and she's going to walk us through. She and Aaron are going to walk us through where we are. So let's start with House Bill 353, Maryland Department of Health 211, Maryland Oversight.
So the bill would alter the definition of Health and Human Services referral system to mean a coordinated system for health and human service resources accessible to all state residents through 211 and other designated technology system. The bill repeals the requirements that the Maryland Department of Health, in consultation with 211 Maryland, evaluate the performance of each 211 Maryland call center, make recommendations to 211 Maryland regarding the quality of service provided by call centers or the performance of call centers when issues related to service quality and performance are presented to MDH, and make recommendations regarding corrective action to be taken by a call center. There is an amendment that has been provided, and this is being sponsored by Delegate Cullison. So this amendment would be added to the bill, and it's uncodified language that would add 2 call center representatives nominated by the call center to the 211 Maryland Board of Directors.
Can I get a motion on the amendment?
Move the amendment.
Second.
All right, it's been moved and seconded. Delegate Cullison, Madam Vice Chair.
Thank you, Madam Chair. I appreciate the opportunity. Very quickly, in the Health Department is comfortable with this bill because they feel that their contractual relationships around different programs and the financial relationship, that they have enough oversight in terms of how it is affecting and implementing its programs, the Maryland Information Network. So they're comfortable with it. What the concern we heard in the hearing was that the call centers themselves were concerned that they were not having enough representation on the board. So we are increasing the board by 2 members to be seats that are specifically designated to members, representatives of the call centers, and they would serve on the board. So I appreciate your consideration of the amendment in the bill. Thank you.
Thank you, Madam Vice Chair. Are there any other questions, concerns, discussions on the amendments? All right, all in favor say aye. Thank you. Anyone opposed, go ahead and raise your hand in the chat. If I can have a motion on the bill as amended.
Move the bill as amended.
Second.
All right, it's been moved and seconded. Any further discussion? All right, all in favor say aye.
Aye.
Anyone opposed, go ahead and raise your hand in the chat. All right, House Bill 353, Maryland 211 passes unanimously. Didn't we just do this yesterday?
We did.
With 988 and all right. Now we're going to go to House Bill 822, Maryland Medical Assistance Program, Employed Individuals with Disabilities. Aaron, if you can talk us through the bill and the amendments, and then Madam Vice Chair, if you want to speak on the bill.
So this bill would require the Department of Health to provide employed individuals with disabilities program services to qualified applicants, including existing Medicaid recipients who are at least 16 years old, for initial applications for EID program services, accept documents to verify income and resources, transition Medicaid recipients who are eligible for the EID program in a manner that is least disruptive to the recipient's access to services, ensure that the application process for the EID program, to the extent authorized by CMS, provides maximum flexibility and plain language information for applicants, establish a premium contribution that is based solely on an applicant's earned and unearned income. The bill, as introduced, prohibited the department from limiting eligibility to receive EID program services based on the earned or unearned income of the applicant's or applicant's spouse, or any assets or resources of the applicant or applicant's spouse. The bill also would have required, would have prohibited the department from establishing an upper age limit on eligibility to receive EID program services. And it would have required the department to meet with a state-based coalition of disability advocates twice a year to receive feedback on and discuss any needed changes to the EID program. There is an amendment that is being proposed by the bill sponsor Delegate Cullison. So this amendment would strike the provisions in the bill that are related to premiums and the upper age limit, and instead have the department study those issues.
Move the amendment.
Oh, thank you. It's been moved. Do I have a second?
Second.
All right, thank you. It's been moved and seconded. Vice Chair Cullison.
Thank you, Madam Chair. We've all been particularly moved by this group of folks who came to us asking for this bill. And we would really like to meet their needs and help them thrive in their jobs, in their communities. However, what's being asked for are major changes in the program and that have not only fiscal impact, but equity concerns around the Medicaid delivery programs or premium programs. So we believe that we need a little more work, a little more time in order to discuss this, to involve the coalition with DMH and have a report back for this body to look at next January, and with a bill that we think will help to satisfy some of these concerns that our constituents have brought to us. So thank you again for your consideration of the bill.
Thank you, Madam Vice Chair. Delegate Chisholm.
Thank you, Madam Chair, and thank you, Madam Vice Chair. I like this bill, but obviously I have the same concerns you do. And in speaking with my wife about this, she did ask me a question. I don't know if this will be part of the study. She said, some people that are on disability, obviously she works with a lot of autistic people, and there's different, levels of disability. There's different spectrum levels. How is the Department of Health going to kind of figure out, because some people are quote unquote fall under the disabled category, but they're almost, much more fully functional than others. Do they take that into consideration? How are they going to kind of figure all of that out? Any thoughts on that?
Thank you, Delegate Chisholm. And you're right, it's complicated. And we actually have the Secretary of Health and the Secretary of Medicare and Medicaid on this call. So I don't know if we can answer that, but if we can just raise the question of, will that be something that's considered in the study? And Mr. Moran, go ahead.
Yeah, thank you, Delegate Bagnall, and thank you, Vice Chair and Delegate Chisholm. So the current eligibility of the program, Delegate Chisholm, applicants are eligible based on disability that meets Social Security's medical criteria. We can certainly give you that. And so any of the changes that we would be thinking of part of the program would be using that eligibility criteria. There are also some other criteria for the program as well, and I think we would be taking a look at that as part of the study.
And so we just need the time. Is that the consensus?
That's correct.
Thank you very much. And thank you, Delegate Chisholm. The amendments have been moved and seconded. Any further discussion? All right, all in favor say aye. Anyone opposed, go ahead and raise your hand in the chat. Can I have a motion on the bill as amended?
Motion to move the bill as amended.
Second.
All right, it's been moved and seconded. Any further discussion? All right, all in favor say aye.
Aye.
Anyone opposed, go ahead and raise your hand in the chat. Give you a moment. All right, and the bill passes unanimously. Thank you very much. Thank you for your work on this, Madam Vice Chair.
And thank you. Thank you very much. See you on the floor.
All right. We're going to now turn to House Bill 1100, Health Child Advocacy Centers Reporting Requirements and Investigations. Aaron, if you can walk us through the bill and the proposed amendment.
So there is an amendment that was provided, actually probably separately from the amendment, from the email that I sent this morning. So there's a follow-up email sent around 8:45 that includes this work group amendment to House Bill 1100. So this would replace the bill as introduced and instead require the Governor's Office for Crime Prevention and Policy to convene a work group on oversight of child advocacy centers. The work group will include state and local agencies that interact with or have oversight of components of child advocacy centers, including the Department of Human Services, Department of Health, applicable health occupations boards, the Governor's Office for Children, and the Office of the Attorney General. Will also include the Maryland Children's Alliance, local CAC representatives, the National Children's Alliance, the Maryland Child Abuse Medical Providers, state and local law enforcement, the state's attorneys, public defenders for child abuse cases. And the work group would be required to examine oversight of child advocacy centers under current state law, accreditation standards, a scan and review of available clinical services and fiscal resources to comply with best practices and accreditation standards, and whether any additional oversight is recommended. To the extent practical, the work group must leverage existing work and committees that review issues related to child advocacy centers, and the work group will report to the governor and to the General Assembly on or before December 1st, 2024.
Thank you, Erin. And I think the overarching theme today is it's complicated, right? It's complicated. Chair Peña-Melnick.
And good morning, and I'm sorry I have my video off, but I am in two meetings, in delegation and this one, so double screening this morning. I want to thank Erin for her flexibility, and I want to thank the Department of Health for working on this. This is they're not regulated at all by the state. They're regulated by the federal government. Our children that are the most vulnerable are the ones that are being serviced by this program. And the hearing was very disturbing. And I really feel that this work group will be able to look at it and try to find the best way where we can oversee or be part of these children's lives and make sure that they are well taken care of because they're from our state. It is complicated, and I felt that we couldn't pass the bill without sitting everyone at the table. And I thank the Department of Health for helping us sort it out. I want to thank Ms. Dorothy Lennick for she's here on this call for being willing to working with us as well.
Thank you, Madam Chair. Do we have a motion on the amendment?
Move the amendment.
Second.
It's been moved and seconded. All right, we're going to open it up for discussion. Mr. Shattuck?
Yes, thank you. And Delegate Cardin's on the line, and I don't want to jump in front of him if you wanted to say.
That's okay. That's okay, Dan. Go for it.
Okay. All right. So thank you, Madam Chair and members of the subcommittee. I'm speaking on behalf of the Maryland Psychological Association. We looked at the language for the first time this morning with Delegate Cardin, and we had some suggested, amendments we wanted to put forward. The focus of the work group didn't include our members of the Maryland Psychological Association. We think it's important that we be included, as well as a couple of the other stakeholders that have been supporting, make sure that the focus is brought to the continuity of care issues that we brought forward the last 2 years, and trying to keep the focus on certainly the mental health services that are being provided, because that's where we have experienced the challenges and the difficulty. The bill this year, we tried not to encompass the law enforcement aspect and the other medical providers, because after the bill hearings from the year before, it really focused on the I don't want to say longevity, but the mental health services would go on for a period of time, whereas other medical providers that are involved with the CACs, it might just be 1 or 2 times. They didn't have that sustaining relationship. So all that to say, we did email some language to Ms. Hopwood, and we shared it with you, Delegate Bagnall, and with Chair Peña-Melnick as well, just hoping that, as we do want this bill to advance, and we think the study's the way to do it. We just had a couple changes we wanted to put forward. So thank you.
Thank you very much. Ms. Whitten.
Good morning, Delegate Bagnell and committee members. So just want to thank the committee for the opportunity to be engaged in this issue. I'm here this morning representing Center for Hope through LifeBridge Health. First, we haven't seen the latest amendments. They may be the same amendments. I want to acknowledge that Ms. Hopwood did send out some language at 8 o'clock this morning. I have not been able to connect with our executive director with Center for Hope, but if there's additional language, would appreciate seeing that. And I'm seeing Erin shake her head. So I think similar to my colleague, Dan Chaddick, we did send over comments last night to the chair of the committee and also Delegate Bagnell and Erin regarding just some thoughts about the work group. So I think we agree we need to think about what the focus would be. What we heard the proponent say was we wanted to look at some standards around continuity of care and the mental health aspect, which we're very open to. We have a lot of policies and practices that are based on the national standards that are developed. But for just some education with the committee, child advocacy centers are required to follow a number of other standards based on a number of other services that they provide. So I think it's important for folks to understand that they also are engaged in forensic interviews, medical examinations. They work with prosecutors, law enforcement, and so it is a very complex model, and it's a very complex coordination beyond just the mental health services. And so it's unclear to me in the legislation whether or not we are opening up all those standards. And if so, we need to really include other organizations that provide the forensic examinations like the SAFE programs. We think it's important also to provide the CHAMP network and some of the other providers that are engaged in that. If we are going to focus on the mental health aspect, then I think that needs to be clarified in the legislation. And we'd also ask that we make sure that we're following all of the professional code of ethics, so we don't ask our providers to be outside of what their professional code of ethics would be. And I would think that that would be part of the work group's deliberation. So we just ask some consideration for some clarification in the bill before us. Thank you.
Thank you. Thank you, Ms. Whitten. Delegate Cardin.
Thank you, Madam Chairman. So I just I think that what Ms. Whitten just said is right on target. I do the intent of the bill was to focus on the mental health aspect. So I am if the Department of Health believes that we need to include all these different aspects like law enforcement and the providers who are doing like services for physical health, like a broken arm or something where you're only there for 2 or 3 visits, kind of thing. I don't have any problem with that, but I think that the whole idea here and what the Chairman Peña-Melnick talked about is the complexity is that we're trying to care for these very vulnerable people, and it's the folks that have this long relationship with them that we really need to focus on. So if the cost, and there's a question about a fiscal impact, if the cost of this work group is because we're including so many different groups, then maybe it ought to just be narrowed, and then the ethical issues become much more identifiable. I am happy to open it up to everything. That could be a Pandora's box for the CECs. They may not want that, but so that we may want to just focus on the mental health in this work group and then go forward. And I do want it to go along, and I do think that the work group needs to happen no matter what, and I look forward to the results of it.
Thank you, Delegate. And just for the members, I'm getting these concerns on record, and I do have a response. So Mr. Carhanes, go ahead, and then Carcanis, I'm so sorry. Go ahead, and then Delegate Rosenberg, and I'll just make a statement now for the sake of time. I did also request additional language speaking to looking at continuity of care. I do think it's important that we have, that we paint with a broader brush on this, because as we heard in the hearing, there are a lot of moving parts working in concert with these children's advocacy centers, and we cannot simply focus on one aspect of it, because these are our most vulnerable kids that are getting services from a multitude of areas. And so we really do have to be looking at, if we're going to be looking at oversight, if we're going to be looking at how we ensure continuity of care, we've got to look at all of the different aspects, all of the points of entry into child advocacy centers. And so I think that was the thinking behind this work group. And I Delegate Rosenberg. Oh, Delegate Rosenberg, you're on mute.
I guess I'd want to know from Ms. Witten, is there a specific change, or do we know what the changes are? The changes that because you've got a facility care in my district that's very important, newly opened, great evaluations of it. If where the chairman is headed is satisfactory to you and Lethbridge.
Thank you, Delegate Rosenberg. I appreciate that. So a couple of thoughts to that. So the amendments that we saw, the language looks at accreditation standards broadly. And as I mentioned earlier, there are national accreditation standards on a number of different varying aspects of child advocacy centers. That is a different contemplation to what we discussed, the work group initially, as I understood it, would take up, related to continuity of care and mental health. So if we're thinking of looking at accreditation standards across the board, then that is a whole different consideration and approach. And we absolutely need more representation of the different stakeholders that we coordinate with on a daily basis. The other thing I would also ask the committee is that the child advocacy centers provide these services at no cost. They vary. Center for Hope is a very comprehensive model, but we are the only one in the state. Most counties only have an organization through either a county health department, maybe it's through law enforcement, and it may be very limited to the scope and the services that they can provide. So if we are not contemplating the resources that's going to help implement these guidelines, whatever is developed from this work group, we are going to be doing a huge disservice across the state. I feel confident with Center for Hope, but also I think Wendy Myers may be able to speak to some of the other child advocacy centers throughout the state. So I think we need to be very careful about what we're focused on. If we're focused on the mental health aspect and continuity of care, I feel very confident that Center for Hope and others will be able to provide appropriate, I think, framework around that. But it's unclear to me really where we're moving in terms of the focus of the work group.
Thank you. Chair Peña-Melnick.
Yeah, thank you, Madam Chair. The work group in the language, it states that they will look at oversight of child advocacy centers on the current state law. Accreditation standards, which means it's broadly, okay? It's broad, it's not one particular one. A scan and review of available clinical services and fiscal resources, whether any additional oversight is recommended. To the extent practical, it shall look at the existing work and other issues. It is not limited to just these issues. I'm going to hold the bill, but I don't want you to think, and those that have spoken, that you're gonna then pile it up with 100 people. That's not happening, okay? It's not happening. You already have in the work group a representative. So it says representative from the, let me look at the language, from the local CAC representatives. You're already represented, okay? I'm gonna hold it. And Delegate Cardin, since it's your bill, I'm gonna task you with bringing everyone together and trying to come up with language, okay? It may not happen now, it's not gonna happen, I doubt it highly, over crossover, but you have time to work on it now, okay? Let's hold the bill. Thank you.
All right, thank you, Madam Chair. We are going to hold that bill. And we are going to turn to House Bill 1194, Hospitals, Clinical Staffing Committees and Plans, Establishment Safe Staffing Act of 2024. And we started the discussion on this bill yesterday. And there was one, and we said we would give the Hospital Association more time because they were circulating the language with their members. I don't remember if we moved the amendments yesterday, and there's one additional amendment that we needed to discuss. So Aaron, if you can just remind us about what the amendments do, and then we'll continue the discussion.
Okay. Let me make sure. Am I on? Can you hear me?
Yes.
Okay. So the amendments that were discussed yesterday were offered by the bill sponsor, Delegate White Holland. They would require each hospital licensed under Title 19 to establish and maintain a clinical staffing committee that has equal membership from management and employees. The staffing committees must develop a clinical staffing plan for the hospital that establishes the appropriate number of clinicians needed to administer quality health by settings. And then it provides for what the hospital must do when developing the clinical staffing plan. And then on or before July 1st of each year, each hospital through their clinical staffing committee must conduct a review of the plan to evaluate the effectiveness of the plan during the immediately preceding year and update the plan to ensure that it continues to be appropriate and effective. And then it's would require hospitals to provide those staffing plans on request. So that is one amendment that we discussed yesterday. There's also an additional amendment, and just let me know when you want me to
Go ahead. Yeah, go ahead.
The additional amendment. So there is an additional amendment, and this is the PDF document that's labeled final with stamp. This is Delegate Bagnall's proposed amendment. Under current law, each administrator of a hospital must provide annual training to all patient care staff members to ensure their knowledge and understanding of the patient's Bill of Rights. And this just clarifies that annual training must be provided by staff members, or if the hospital is unable to provide the training through staff members, by contracting with a third party.
And just to the members, that additional amendment has already been discussed with the Hospital Association. It's an update of the Patient Bill of Rights. And let me go ahead and open it up, Mr. Whitaker and and then Ms. Townsend. Or actually, Ms. Townsend, you're already unmuted. Go ahead. Go ahead.
Oh, okay. Thank you for the opportunity to have a little bit of extra time to circulate these amendments. We are not in a place to support this bill, even with the amendments. We just cannot agree to a mandate on staffing decisions. So at this point, we're just going to have to agree to disagree.
All right, thank you, Ms. Townsend. Mr. Whitaker, did you want to add?
Yeah, thank you, Madam Chair. I think given that we're also highly regulated by the Joint Commission and CMS, like state hospitals, it'd be helpful to get the rules and guidelines that are saying that we can't have external input to make sure that we're not also affected the same way that the state hospitals are before we proceed.
All right, thank you, Mr. Whitaker. Marie Grant, go ahead.
Thanks so much, Delegate Bagnall. So don't want to, I literally just sent an email to Pegeen and you, Delegate Bagnall, maybe 5 minutes before this meeting to tell you the regulation that's referencing. And I also just wanted to clarify what we were saying in our letter. So first of all, sometimes we draft letters really quickly and they are often, and in this case, we submitted a letter before we finalized language we were comfortable with. with Delegate White Holland. The language that we were referring to in CMS is really about the responsibility of the governing body of hospitals, and to Mr. Whitaker's point, it is across hospitals about the who's ultimately responsible for safety and staffing. But I do want to say that's also not the reason for our exemption. Ultimately, from the amendment, it is we asked for the exemption due to the unique nature of our state regulation of our hospital system. So I just wanted to make that clarification. I don't know I don't think that changes Ms. Townsend or Mr. Whitaker's opinions about anything, but wanted to clarify for the record.
Thank you very much. And I'm going to make a suggestion based on the bill hearing on Roman numeral I, where it says specific guidelines or ratios. There was a suggestion in the bill hearing and then in the discussion yesterday to change specific to suggested. And so I'm going to offer that. And then it becomes a policy question because I don't believe from the discussions we've had, this is creating a mandate. I think it is getting more stakeholders to the table in making those recommendations and looking at those at those staffing ratio plans. And with that, I'm going to call on Ms. White Holland, the sponsor of the bill. Delegate.
Thank you, Madam Chair. And I again would emphasize what you just articulated it again, that this is not a mandate. It just brings additional voices to the decision-making table. Again, I would press this amendment and again would take your recommended language as friendly. And so do not see any concerns in accepting that particular language change, given that was language that the Maryland Hospital Association and their respective members elevated in their response. Again, that if I may remind my colleagues, this is an opportunity for us to ensure that we're listening to the voices of those who provide direct care to patients, to our loved ones. And so I really sincerely hope that again, we're able to ensure that these staffing committees and staffing plans are representative of those who are providing this care along with management. And so, Madam Chair, I press my amendment.
All right, so Delegate White Holland has moved the amendment. Do I have a second?
Second.
All right, it's been moved and seconded. Any further discussion from the members? All right, all in favor say aye.
Aye.
Anyone opposed, go ahead and raise your hand in the chat. Delegate Chisholm, Delegate Riley, and Delegate Hutchinson. Are you asking questions on the amendment or opposing the amendment? Opposing the amendment. Okay,
I thought we were voting on the bill.
We're just voting on the amendment. We haven't moved the bill yet.
I'm fine with the amendment, even though I didn't see it. I know you went through it, but that's fine.
All right.
I'm fine with the amendment as well.
Okay, thank you. Thank you for the clarification. Do I have okay, that's been moved. Do I have a second?
Second.
All right, it's been moved and seconded. Any further discussion from the members? All right, seeing none, all in favor say aye. And if you're opposed, go ahead and raise your hand in the chat. So I have Delegate Chisholm, Delegate Riley, Delegate Hutchinson. So House Bill 1194 passes not unanimously. Thank you very much, everyone. We are going to move on to House Bill 1396. This is drug and alcohol treatment programs, discharge of patients, and referral services standards. Aaron, if you can talk us through the bill and the proposed amendment.
Okay, this is can you hear me again? Sorry.
Yes. Oh, I jumped. I'm sorry. I threw you off. Go ahead.
Yeah, so we discussed this bill yesterday. I walked through it yesterday, and there is a amendment that has been provided that would turn this bill into a study. So if you pull up the amendment provided on 1396 in your email. I know I'm having trouble finding this, but it would require MDH to study the provisions of the bill. And I will read it to you as soon as I can pull it up. Here we go. So this would require the Maryland Department of Health to conduct a study regarding the linkages between the various levels of care within the substance use disorder treatment and recovery continuum of care. The study must examine linkages from high-intensity outpatient treatment programs to a patient's need for comprehensive services, including additional treatment, housing, and other social service supports, and also would study existing requirements related to discharge planning and accreditation standards, statute, and regulations. The department must make recommendations about improvements to existing discharge and linkage requirements, improvements to the process of enforcing requirements. And I would add to this that they would report back to Finance and Health and Government Operations prior to next session.
Thank you, Erin. And again, the overarching theme today is it's complicated. Delegate Hill.
Thanks, Erin. Thank Madam Chair. Is this substituting for the whole body of the bill?
Yes, it would strike the bill and replace the bill with a study. Sorry, I should have said that.
Okay, okay, thanks.
Thank you, Delegate Hill. Do I have a motion
The
on
amendment?
It's been moved. Do I have a second?
Second.
All right, and then we'll open up for discussion. Ms. Lowe.
Yeah, this bill has gone to 2 studies before. And one in 2017 to be reported in 2018. A report was never provided. Then it went back for another study in 2018 to the House Special Committee on Drug and Alcohol Abuse, and a report was not provided in 2019. I don't know that there's a need for a study. COMAR already says that a program shall develop a written treatment plan with participation of the patient based on comprehensive assessment and patient placement criteria. It already says that under discharge, COMAR already says this, continuing service recommendations and summary of transition process. It already says that the individual is involved in the discharge plan as well as the treatment plan. That means they can't have a recommendation to a place where they don't want to go.
And that's why we need to figure it out.
Well,
and Ms. Lowe, I do recognize that there has been a failure to create these reports. We had a very different Department of Health previously. We have a health secretary now that is looking at our entire behavioral health system. And Chair Peña-Melnick.
Thank you so much, Chairman. I appreciate your leadership. Ms. Lowe, the reports were not done before. Okay, I believe that this Secretary of Health will get it done. Okay, so I will, if I were you, I would take this amendment, okay? The bill is not cross, all right? It is, this will make sure that we look at it and we do it intelligently, because obviously, even though COMAR state what you just read, it's not being done. We got to look and see why it's not being done and what recommendations can be put in place. So I would take this win if you're able to get it to pass, okay?
May I say one other thing?
Go ahead.
This bill only requires that a referral process be done and that the discharge plan be developed closer to the treatment plan. And that's all that needs to happen to implement this. We're holding up for one more year patients going to the next level of care. And this bill has been discussed for 8 years.
Ms. Lowe, we
That's
got to
all I
figure
wanted
it
to
out.
say.
No, I appreciate that. I appreciate that. And you have the commitment of our chair. You have a commitment from me. You know that that behavioral health is particularly important to me. And you have a commitment from the Secretary of Health. So we're gonna get this done. We're gonna figure it out.
Delegate Bagnall.
Go ahead,
Ms.
Madam
Lowe,
Chair.
do you want us to hold the bill?
Pardon?
Do you want us to hold the bill?
What are the options? I'm not.
That's it. We hold it and you try to work on it some more.
Or vote right now.
That's correct.
What
we
do
vote
you
right
think
now,
is
we're
in the
voting
best
on the
interest
study.
of the bill?
We're going to work, we're gonna vote on the study right now, okay? Or we hold it and you try to see if you can work it.
By Monday?
That's right. Or you have the next week or two, see what you can do. We're in session until April 8th.
If I hold the bill, and will another vote come up by Monday then? And we can
no,
either vote on
if-
the study or vote on the new language that everyone accepts?
No, the study is until now, today. You can work it out and see what you could do, but the committee is not gonna meet again to vote. Okay?
Okay, Robin?
Madam Chair.
Delegate Hill,
I'd like
I
to
see
work
you.
on the bill.
Okay, Delegate Bagnall, just hold the bill, please. Thank you.
All right. Thank you, Madam Chair. So we are going to hold this bill. And Delegate Hill, did you still want to be heard on?
Yeah, I actually did.
ahead.
Thank you.
Go
I
ahead.
just wanted to make the point to Ms. Lowe that the problem with the bill is that you can't tell people to just do what they're not doing if we don't understand why they're not doing it. And so I think you would do better not holding the bill, accepting what we can get. And as was explained by the chair, let us figure out why this isn't being done. The bill is not actionable as written. It's just not.
Thank you, Delegate Hill. All right, we are going to we're going to go on to House Bill 119. We will still be meeting if we have a change of heart on House Bill 1396, to Delegate Hill's point. But for now, we are holding that bill. House Bill 119 is Public Health, Giving Infants a Future Without Transmission, the GIFT Act. It's been a while since we heard this bill. The Health Department was working on some amendments for us. So Erin, if you can walk us through the bill and the amendments.
Okay, and there's a reprint provided of this bill.
Thank you.
And it incorporates amendments that the department has worked on with stakeholders. The bill would alter terminology and requirements related to HIV testing and reporting, including requiring universal syphilis and HIV testing for all pregnant women at the time of delivery, newborn HIV testing when the mother's HIV status is unknown, and inclusion of pregnancy status when reporting an HIV diagnosis. A hospital is required to determine the syphilis serologic status of a mother before discharging the newborn for the purposes of neonatal evaluation and treatment. If you look at the reprint, the amendments appear on page 2 of the bill. And this deals with the under current law where a healthcare provider must submit reports on HIV status to the local health departments. And this would provide that those reports are not admissible in evidence in any criminal, civil, or administrative action. Under current law, they're only not admissible in evidence in any civil action. So a similar amendment appears also on page 4 of the bill in line 5, and that it's the same situation with reports from the department regarding HIV status not being admissible in any criminal, civil, or administrative action. And then there is an additional amendment in the reprint, if you look on page 6 of the bill, that under the bill, when a patient unless a patient declines, a healthcare provider must obtain a fluid or tissue sample for the purpose of testing the fluid or tissue for the presence of HIV infection from the body of a pregnant woman, and that strikes the body of language.
If I can have a motion on the amendments.
Move the amendments.
Do I have a
Second.
All right, it's been moved and seconded. Do we have discussion? All right, seeing none on the amendments, all in favor say aye.
Aye.
Any opposed, go ahead and raise your hand in the chat. If I can have a motion on the bill as amended.
The bill is amended.
Second.
It's been moved and seconded. Thank you so much. All in favor say aye.
Aye.
Anyone opposed, go ahead and raise your hand in the chat. All right, House Bill 119 passes unanimously. And we have one more bill today. Sorry, I'm jumping around. House Bill 1521, Maryland Children's Health Program Eligibility and Administration. We heard this bill yesterday from Deputy Secretary Moran, who is still here. Thank you. Is still standing. But Erin, if you can remind us what this bill does.
This was heard yesterday, as Delegate Bagnall said. It's an emergency departmental bill that repeals the requirement that the Maryland Children's Health Program be administered in a specified manner. As a result, the bill eliminates the MCHIP premium plan and the requirement that families with income above 200% of federal poverty guidelines pay a family contribution for MCHIP coverage.
And can I have a motion on the bill?
Move the bill.
Second.
It's been moved and seconded. Any further discussion? All right, all in favor say aye.
Aye.
Anyone opposed, go ahead and raise your hand in the chat. All right, House Bill 1521 passes unanimously. That ends our work in subcommittee. I did want to, I see that Ms. Lowe is still in the call, so I did just want to make sure that we are all agreed in holding that bill, because Delegate Hill.
Ms. Lowe, well, you know what? I know you're not a member of the committee, but you're the main advocate for this bill. And I'm going to ask that we go ahead and move this bill. I think we're running out of time. We don't have the information from the previous studies to base a decision on. And if we don't do this, nothing's going to happen because the bill is not actionable. So as a member of the committee, Madam Chair, I would like to move the bill.
Move the amendment.
Second.
All right, it's been moved and seconded. All in favor of the amendment, say aye.
Aye.
All right. Anyone opposed, go ahead and raise your hand in the chat. On the bill as amended, don't worry, Ms. Lowe, I see you. I'm not gonna take the vote and before we hear from you, but I just need a motion.
The bill as amended.
Second.
All right, it's been moved and seconded. We're gonna open it up for discussion. Ms. Lowe.
So I have an idea. I know you guys don't know this, but the treatment providers that I spoke with yesterday, the good ones who get 100% of their patients into next level of care, I can call every single good provider that I know and get a 1-sentence, 2-sentence reason how they move 100% of their patients to next level of care. And they will tell you that there's a difference between following the COMAR that we currently have and giving a patient a packet and kicking them back to the street, or making a referral.
All right, I want to call on my members because
And that's it, is the referral. That is it.
Okay,
And
Delegate.
if I get 20 treatment providers who say, we get our patients to the next level of care because we make the referral, and without making the referral, the patient won't move.
Ms. Lowe, hold on one second.
Will that do it?
I need to call on my members, Delegate Hill and then Delegate Alston.
Thank you, Madam Chair. And to Ms. Lowe's point, I think I would like to go ahead and move the bill as amended. If Ms. Lowe is able to give information that actually is actionable from these providers, that is why they can do it and others can't, and we can change COMAR to address that, then we can always amend the bill on the floor. I think we move forward.
I agree. Delegate Alston.
I was going to say, if she feels that passionately about it, then hold the bill and let her do what she wants to do. It's her, it's their bill. And I think that what she may be missing is that by holding it, it's going to effectively kill it for the session. But if that's what she wants to do, just be clear that that's what's happening. But let's not force the study and force people to work if they don't want it.
Well, I think what I'm hearing, and I appreciate that, Delegate Alston, but I think what I'm hearing from this subcommittee is that we want to move forward on this.
And I don't want to kill the bill.
Yeah, and we don't want to kill the bill. So we do have a motion on the bill. It's been seconded. A motion on the bill is amended. All in favor, say aye.
Aye.
Anyone opposed, go ahead and raise your hand in the chat. All right, it passes unanimously. Ms. Lowe, I'm going to go ahead and encourage you to continue to reach out to your stakeholders, see if you can get that information to us. We'll see if to Delegate Hill's point, if that can inform us, because we do have the opportunity to amend it, but this will keep the bill moving.
Understood. Thank you.
Thank you. And thank you for your advocacy. We really do appreciate it. We know that this is that you are passionate about this, and we just want to make sure that we're moving meaningful policy. So thank you for being here and for advocating.
And thank you. I am filling in for Delegate Howard. He is COVID the best I can. So thank you for the opportunity. I appreciate it.
We appreciate you. With that ends our work for this subcommittee. If I can have a motion to adjourn.
Move to adjourn.
So moved. Second.
Been moved and seconded. We are adjourned. I'll see some of you in 7 minutes.